Hey everybody, how you guys doing today? This is Jim Prusak, licensed physical therapist here at the Pain PT, and good to see you all today. Today is evidence of the week, which I try to bring to you each week, covering some of the research out there and what we understand and know about these somatic symptoms we experience in our body that typically are not your normal physical structural symptoms we see from injuries and things like tumors and cancer and things like that. So let's go over today. Today's evidence of the week is going to be around somatic symptom disorder and what's called bodily distress disorder. Some of you may have heard of these terms, and a lot of you probably have never heard of them. These are two diagnoses that are actually official diagnoses that are given. One is called somatic symptom disorder. It's in the DSM-5, which is a psychological manual for diagnoses. And the other one, bodily distress disorder, is in what's called the ICD-11, which is a medical diagnostic category that healthcare practitioners can use. And I want to go over the differences and similarities between these two diagnoses and see if they apply to you, because you may have somatic symptom disorder or bodily distress disorder. That might be your diagnosis, not fibromyalgia, not all the other labels you've been given that are inaccurate or not describing what you really have. So I think you'll find this interesting today. These are actual medical diagnoses that are in official manuals that we can use for billing insurance and also creating a diagnosis, just like somebody says you have chronic fatigue syndrome or fibromyalgia or migraines. I'm going to challenge that and say a lot of these conditions that people are given those aren't the real diagnoses. The diagnoses are more likely to be somatic symptom disorder or bodily distress disorder, or both of those. So let's dive into some of the research on this, and I'll take you through this today. Okay, so again, let's start with somatic symptom disorder. Remember, somatic symptom disorder, again, is a condition that many people have in terms of the population. It varies in terms of what they see in terms of their prevalence rates. I'll go through some of that in the last study today. But let me take you through from what the Mayo Clinic here describes as somatic symptom disorder and how it's actually, what are the characteristics of it? What are the criteria of it from the DSM-5 manual, okay, which they updated. So they updated the manual and they removed some of the older diagnoses like somatoform disorder, somatization, some of these other terms, and they lumped it under one term now called somatic symptom disorder. And here's the overview from the Mayo Clinic. It's a disorder characterized by an extreme focus on physical symptoms such as pain or fatigue. It could be any symptom that causes major emotional distress and problems functioning. So somatic symptom disorder, as you're going to see, it's really focused more as a psychological diagnosis, mental health manual, the DSM-5. So it's geared more about the psychology behind it. Okay, and you're going to see body distress disorder because it's in a medical diagnostic manual is focused more on the symptoms themselves and the attention that people give them. So those are the distinctions. So with somatic symptom disorder, you often think the worst about your symptoms, frequently seek medical care, right, which is also going to be similar to bodily distress disorder. You continue to search for explanation when other serious conditions have been excluded, becomes a central focus of your life. And again, the types of symptoms that you can see can be anything. They said specific sensations such as pain anywhere in your body, shortness of breath, more general symptoms like fatigue or weakness, unrelated to any medical cause that can be identified. Sometimes they say here now that they broaden this classification that it could include medical symptoms as well. But for the people that I see and we talk here, there's typically not a true medical diagnosis or something really wrong with the person. Okay. These are mostly unexplained medical symptoms. It can be a single symptom or multiple symptoms, mild, moderate, or severe. Obviously, pain is the most common symptom. That's the one we see most in people, but it could be any number of symptoms. And here's the key takeaway as somatic symptom disorder. It comes with excessive thoughts, feelings, and behaviors related to those symptoms. And these are three of the areas that I talk about in those categories, right? How we can we're going to overcome this. We've got to work on our thinking. We've got to work on our emotions, our feelings, and our behaviors. We've got to shift these things. So these are three of the criteria that we see that there's excessive thoughts, feelings, which are emotions, and behaviors related to these symptoms, which cause significant problems, make it difficult to function, sometimes be disabling. And they have a list here from the Mayo Clinic, and this is part of the criteria for somatic symptom disorder. These thoughts, feelings, and behaviors can include constant worry about potential illness, viewing normal physical sensations as a sign of severe physical illness, fearing that symptoms are serious even when there's no evidence, thinking that physical sensations are threatening or harmful, feeling that medical evaluation and treatment have not been adequate, fearing that physical activity may cause damage to your body, repeatedly checking your body for abnormalities, frequent healthcare visits that don't relieve your concerns or make them worse, and being unresponsive to medical treatments, or unusually sensitive to medication side effects, um, having a more severe impairment than is usually expected from a medical condition. So these are some of the criteria here that you see, and many of you may be nodding your head, yep, I have that one, that one. And so this would be some of the criteria that you have somatic symptom disorder, okay? And again, some of the causes here, they're variable, right? Sometimes there's a small genetic component. It's not very large from what they've shown, maybe somewhere around less than 10% up to maybe less than 20%. So more of it environmentally, more of it learned. Okay. But sometimes people have, like they mentioned here, increased sensitivity to pain. That's called sensitization. We have this term highly sensitive people. Some of you may be saying, yeah, I've always been a sensitive child. I was a sensitive child. I was sensitive to things. Well, that could be a biological genetic component that makes you more apt to have these conditions. Again, family influence here, genetic, environmental, personality trait of negativity. Okay. A lot of people are, like I mentioned before, those gnats, a lot of people real negative thinking. Um, Here's a big one, decreased awareness of or problems processing emotions, causing physical symptoms to become the central focus rather than the emotional issues, right? This is from the Mayo Clinic. This is what we talk about a lot, how emotions are also important and are intertwined here is that the old definition of somatization, which is no longer used, was really how emotional distress manifests physically in your body as physical symptoms. Okay, they removed that diagnosis and lumped it into the somatic symptom disorder, but still emotional component is there. Learned behavior. Okay, I talk a lot about learning to conditioning, association, and then what we call predictive coding. Okay, so that can be a part of this too. Some of the risk factors for somatic symptom disorder include having anxiety or depression, right? I just talked about anxiety the other day, how it can cause hundreds of symptoms in your body. These panic attacks all over, you can check that out. Anxiety and or depression. So those two are the biggest things we see, mental health issues that are comorbid or that exist with chronic pain and other chronic symptoms. Upwards of almost 50% of people have anxiety and or depression with chronic pain and chronic symptoms. So some of the risks for somatic symptoms include having anxiety or depression, having a medical condition or recovering from one, right? I've seen some people where they had a surgery or something like that, or some other condition, and it really got into their head and they started to really worry about it, right? And they changed their behaviors, overthinking, started to have distressful feelings around it, and then morphed into something chronic. Okay. I've shared some of the data around that too. For example, whiplash people from car accidents having an acute injury and then end up becoming chronic pain after a year because of the anxiety the person's had around the accident. Um, Being at risk for developing a medical condition, strong family history, disease, right? Seeing other people in your family suffer through things, experiencing stressful life events like trauma or violence, right? We know this. Having experienced past trauma, such as childhood sexual abuse. So these adverse childhood experiences, right? The ACE scores, which I'll talk about another time. ACE scores, again, we've talked about that a little bit here. They're very much linked and predisposed and put at risk for a person to develop a somatic symptom disorder or chronic disorder of health nature down the road. Having a lower level of education, socioeconomic status. Okay, so it leads to, again, all these different things here, right? This is a somatic symptom disorder. And again, it's various prevalence rates in the population from anywhere from 5 or 7%, in some studies up to much larger, 30, 40%, depending on the population that they're studying. Okay. And we look at bodily distress disorder now, which is this other diagnosis. And bodily distress disorder, like I said, is in the ICD 11, okay, which is again the diagnostic manual for medicine. Okay, not psychological medicine, but physical medicine, right? So somatic symptom disorder is over here in a psychological diagnosis. Bodily distress disorder is a medical diagnosis. They're both overlap, right? So the bodily distress disorder diagnosis came out a little more recently, all right? I can't remember exactly what year, but it hasn't been that long ago. And the difference here, and they say it here when I just looked at what's the difference between these two things here, both of them are related to physical symptoms, which is what everybody's here for, but they have distinct characteristics. So bodily distress disorder um, is defined by persistent bodily symptoms, and typically sometimes more symptoms than you would see even in somatic symptom disorder, but that are distressing to the individual and cause excessive attention or preoccupation. Now, remember, that's one of your other categories that I try to address is your attention. Okay, they garner a lot of excessive attention or preoccupation. And so bodily stress disorder doesn't bring in the psychological side so much as the thoughts, the behaviors, the emotions. It's really about how many physical symptoms you have or how distressing they are and how much attention that you give to them. Okay. And that's really the difference here. There's more, and because, right, one diagnosis is coming from a mental health area and the other one, bodily distress disorder, is coming from a physical medical diagnosis. Okay. So somatic symptom disorder, again, psychological features, disproportionate thoughts, feelings, and behaviors related to the symptoms leading to distress and dysfunction. Bodily distress disorder, same thing, having similar symptoms in the body that are distressing to the person and causing excessive attention or preoccupation, medically unexplained as well, or they could be associated with some kind of condition. But it's mainly around this idea that there's excessive attention and preoccupation with the symptoms, and that can lead to repeated contact with healthcare providers trying to find answers. Okay. They give an example here of bodily distress disorder, person experiencing multiple distressing symptoms, physical symptoms that are persistent and cause them to seek medical attention frequently, even when they're reassured by doctors. Okay. Again, finally, just one more thing here. They mention the key difference here between these things is that somatic symptom disorder emphasizes the psychological impact of symptoms, which are these excessive thoughts, feelings, and behaviors, those three things. And bodily distress disorder focuses more on the distressing nature of the symptoms and the excessive attention they receive. So a lot of times we're going to see overlap, right? We're going to see both, potentially you have both of these diagnoses at the same time. And again, it's interesting. They came from two different models, one from a psychological world, one from a medical world. So they're not, and they've talked about this in some other studies that, they're different diagnoses, but they're very similar, but they tend to overlap in a lot of ways. I want to finish up today with a paper here. I can bring you through that actually looked at the differential rates or the overlap between these two diagnoses in a population here. And this was a paper done pretty recently, 2023, in General Hospital Psychiatry. And this was done in China. And they said the title of the paper was The Distribution of Somatic Symptom Disorder and Bodily Distress Disorder or Syndrome in General Hospital Outpatients in China. Okay. So they wanted to see this as a multi-center cross-sectional study here. There's about 1,000 people involved in this. And they were trying to differentiate between these two and see if there's any overlap between these diagnoses. And so what they say here again, that it was 2013 that DSM-5 made this new diagnosis of somatic symptom disorder. And I've already went over that, what that represents. And then this bodily distress disorder or bodily distress syndrome is a little bit more recent. Okay. And it said that kind of covers a more broad area They said the bodily distress syndrome or disorder is proven to capture the majority of functional somatic syndromes, okay, such as fibromyalgia, functional gastrointestinal disease, chronic fatigue syndrome. And it says here from a study that greater than 90% of the patients suffering from functional somatic syndromes, so these again, functional meaning nothing wrong with the body, medically unexplained symptoms, meet the criteria for bodily distress syndrome or distress disorder. There's a slight difference in how they describe these two, but they're basically the same thing. Again, the somatic symptom disorder is more about the psychological. You got to meet the psychological criteria to have that diagnosis. And the prevalence rate, according to this paper here, of somatic symptom disorder, it is a wide range, anywhere from 5% up to 93%. So it could be depending on the population. All right. And what they found here in a former study, these authors did two other studies in the past on both these somatic symptom disorder and bodily distress disorder or syndrome. They found prevalence rates of about 34% of somatic symptom disorder and 27% of bodily distress disorder syndrome. Okay, so in this particular study, again, what they found here was they compared these two diagnoses. They found a moderate overlap between the two. Okay, that of the people who had somatic symptom disorder criteria, about 54% met the criteria for bodily distress disorder syndrome. And the patients who had bodily distress syndrome disorder, 68% had somatic symptom disorder. Okay. And the people who had both these diagnoses had the highest level of symptoms, highest level of psychological distress, symptom severity, depression, anxiety, and they had the lowest quality of life, okay, versus just having one of these diagnoses. So again, they're different diagnoses, but they tend to overlap, okay? And we see here that you could have both of them, right? And one, like I said, is more geared towards the number of symptoms or symptoms you have and the amount of attention it garners and the amount of distress it gives you and focus on the symptoms. That's the bodily distress disorder or syndrome. And again, the somatic symptom disorder is bringing more of the psychological side of the excessive thoughts, feelings, and behaviors that you have around these symptoms. So, do you have these diagnoses? Just think for yourself. Do you meet these criteria that I mentioned today, which a lot of you probably do? And these are more modern day diagnoses we can use that are more accurate, that are really describing what you have versus I have fibromyalgia, I have, you know, IBS. These diagnoses, in my opinion, these labels do not help because they're giving you a medical diagnosis that is can take you down a terrible road of going and thinking you have this and then going on message boards and right getting more negative, and that's a somatic symptom disorder, right? You're going to have more negative thoughts, feelings, behaviors, and more attention. That's a bodily distress disorder. You're going to focus on it more. So these are more of the accurate diagnoses, just like TMS, but Dr. Sarno gave that diagnosis. That was good because it took people off of, hey, I don't have chronic pain. I don't have a migraine. I have TMS, right? So we want to have a different diagnosis. And I know it's confusing because there's lots of labels out there now. We call these neuroplastic symptoms as well, neural circuit disorders, mind-body syndrome, right? Nociplastic pain, somatoform disorder. We have all these terms here that we can use, but I just want to highlight today two of the medical diagnoses. One is a psychological diagnosis, one is a medical diagnosis that are in the manuals that are official that you can be diagnosed as. But how many of your healthcare practitioners have diagnosed you with either of these two conditions? I bet you not many, even though that's probably what you're experiencing here. So I hope this is helpful, everybody, to give you a more accurate understanding of two diagnoses that exist in manuals that are official and that have certain criteria, and that maybe what you have instead of having these other physical diagnoses that are inaccurate and not true. If you like today's video, please give it a thumbs up. That's how the word gets around. More people can learn about this information that's not out there. Again, if you like the channel and you haven't subscribed, please do because you'll continue to get updates when videos drop. I'll continue to drop videos for you guys. And if you need help, you're struggling, you're suffering, you just seem to can't get out of this, you don't know if you have one of these two diagnoses, please reach out. This is what I do for a living. This is what I want to help you with. This is my passion to get people back to living their lives again, getting over these conditions and getting back to life. So reach out if you want more help at thepainpt.com, and we'll see you guys next time. Bye bye.